Hello and welcome once again to World Health plus Social Good. I'm Vismita Gupta Smith and we're coming to you live from the 71st World Health Assembly here in Geneva, Switzerland. Welcome and thank you for joining us. At the Assembly today, member states approved a very ambitious strategic plan, a 5-year strategic plan for WHO, outlining our mission and goals. WHO's mission is to promote health, keep the world safe, and serve the vulnerable. And our goal is to reach 3 billion people by 2023. Susanna will ask your questions from our experts. Let me give you a brief overview of our show for today. We'll talk about one of our missions to serve the vulnerable. Many health issues come under this area of work, but in order to improve the health of 1 billion people, we are going to focus on some of the top killers. We call them non-communicable diseases because they don't spread from one person to the other. You know them as heart disease, stroke, cancer, and diabetes. The food we eat and the air that we breathe can increase the risk of some of these diseases. And in a moment, we will talk to some of our experts about both of these issues, about air pollution, both indoor and outdoor, and about reducing trans fats. We'll also check in on the latest on the work on improving the health of mothers, of women during pregnancy and childbirth. We're going to look at newborns and how we can increase their chances of survival and how we can help them stay healthy. Finally, in today's show, we're going to talk about assistive technology. We live in a time when many assistive devices are available to overcome many of our deficiencies of hearing, of sight, vision, mobility, and many other areas. But you'll be surprised to know how few people actually have access to these devices. So we will talk about all of these issues. Don't forget to send us your questions. Let me start with air pollution. Air pollution levels remain dangerously high in many parts of the world, and WHO recently released a report to help quantify some of the problem. I have guests here, Dr. Maria Neira, Director of WHO's work in Environment and Health, Heather Adair Rohani. Heather is going to talk to us about indoor air pollution, and Nathan Borgford Parnell. Nathan, you are representing Climate and Clean Air Coalition. Welcome and thank you for joining us, all of you. Let me start with you, Maria. Give us some of the highlights from this report.
This is a very dramatic situation. As you rightly say, the levels of air pollution at the moment are dramatically high. And the problem is that this is affecting very much our health. We are talking about, the figure is horrible, 7 million premature deaths happening every year because we breathe air that is polluted and those particles are going very deep on our lungs and in our cardiovascular system, causing all of those diseases, representing 7 million premature deaths every year. So any moment now, when you and we are talking, there is people breathing air that is somehow contributing for them to have diseases and in the long term even finding dead.
So, Maria, you work with these figures every day. What surprised you about this report?
Well, somehow we knew that the figures will still remain very elevated, but the fact that this trend is still very dramatic and dangerous, and the fact that it's a risk factor that we could modify, we could reduce that mortality, but of course we need to take some interventions. Most of them will be related to the way we commute, we use transport, the energy we use. Obviously, if we keep using fossil fuels, pollutants, and the energy that is not contributing to create a better environment, a healthy and more sustainable environment. Obviously, there are other sources of pollution as well, the waste management, the way we produce, we consume. It's all our lifestyle, and removing that risk factor will be easy and will generate a lot of health benefits. And in addition to that, it will be good for our sustainable development, for our economies, and socially as well. So only positive things about if we start to tackle air pollution now.
So I know that our viewers will have a lot of questions on this topic. So please don't forget to tweet us your question at WHO. You can also post your questions on our Facebook Live feed. Maria, I've lived in countries where air pollution levels were very high, and it was very difficult to explain even to our peers that this is actually causing damage to us. We are not there anymore. People understand that air pollution causes adverse health effects. But tell us, why is it so difficult for people to usually pay attention to air pollution?
Well, when you live on certain cities around the world, and most of the megapolis now around the world, they have very high levels of air pollution. When you live in those cities, believe me, you feel it.
Yes.
People start to feel that this air that they are breathing is causing them, particularly they feel the respiratory diseases.
Right.
They feel bad. But if you are conscious of that, you can put a lot of pressure on your policymakers, on your governments. The diseases that are associated to this exposure of air pollution are terrible. We are talking here about chronic obstructive pulmonary diseases, asthma, for instance. People will understand asthma. We are talking about stroke. We are talking about heart diseases. We are talking about lung cancer, and pneumonia in children. Those diseases, people are starting to connect it very well and see the linkage between the air we breathe and all of those diseases. And this is our hope, that with the reports that we are producing now regularly and giving the levels of pollution, because that's very important.
Right.
We have produced those levels of pollution, and you can see in the city where you live, if you go to WHO's map, you can see the level of pollution to which you are exposed on a daily basis.
Right, because in many cities you can't see the pollution. These are fine particles that we are talking about. So the first step is to monitor it and to know what is the quality of air that you're breathing. I find that the next barrier is usually people don't know what they can do about it. And if we can't do something about it, then you don't know how to act to change that situation. What can people do about this?
First of all, to be informed. I mean, the moment they understand that air pollution represents a major risk for their health, that's the first thing. Because that will allow them to put pressure on their politicians, to put pressures on their mayors, because they are the ones that need to take measures. Of course, you as an individual, you can take some actions as well. Reduce the use of your private car and going a little bit more on a public transport system. Be very conscious of the way you use energy, energy efficiency, don't waste and generate incineration. I mean, there are many things you can do as an individual. But more than anything is putting pressure on your politician, creating a movement, demanding more and demonstrating, I mean, putting a pressure on those who can take those measures and reducing this air pollution. This is our lungs and our brain is paying the price of all of this pollution, and this is absolutely unacceptable.
Right. You're absolutely right. And the first step to change seems to be creating the political will through awareness in the constituents. I want to come to you, Susanna, to take some questions from our viewers.
Great, thank you. I wanted to let everyone know we've got viewers joining us today from all around the world, including Jordan, Brazil, Ireland, Pakistan, Somalia, Nepal, Iraq, St. Lucia, Mexico, and many other places. So we appreciate everyone who's tuned in today. We have a question regarding if the UN is able to pass resolutions regarding air pollution to protect those in developed as well as developing countries in future generations.
Actually, in this place at the World Health Assembly, 3 years ago, we passed an incredible resolution called Air Pollution and Health, where all ministers of health, not only they recognized that it was a problem and they recognized the terrible figures associated with exposure to air pollution, the measures that the health sector can take to mobilize and to generate more action, and to what commitments they were ready to engage on it, as well as what is the role of WHO as the Secretariat. So this resolution was passed. It was a very incredible moment because obviously we were not talking about diseases, we were talking about the causes of diseases that touch on all the sectors of our life. And then 1 year later, they approve what we call a roadmap, where we define it very clearly what are the actions we need to do on scientific evidence, on monitoring data about air pollution, on the interventions, on the recommendations for the different sectors, and how we will be hopefully put in place scaling up this movement that is needed, this action that is needed to reduce air pollution and protect people's health. So I hope that this new World Health Assembly will keep this momentum. Now that we launched the report, that the figures are even bigger, we need to do even more. And the awareness is almost there. So I think we are almost ready for more.
Thank you, Maria. I want to continue our conversation, but shift our focus to indoor air pollution. Heather, I remember growing up in India, I used to visit my grandmother in Kolkata, in Calcutta, and she used to cook in a mud oven using coal, and the food was delicious always. Of course, that has changed for my family now, but I do remember a lot of smoke coming out of it, and that is a reality for many, many households now, where women will cook in smaller kitchens and huts, closed environments. A lot of the times they have a little baby next to them as they're cooking. And all of this smoke, the indoor air pollution is impacting them. Talk to us about how big this challenge is.
Oh, this is a very simple solution, a simple answer. 3 billion, 3 decades. 3 billion people are still relying on polluting fuels and technology each and every day for cooking alone. This is every morning. They can't turn a switch on to their stove to cook something. They're actually having to prepare their fire, breathe over this fire. And the levels of air pollution they're exposed to are way above WHO guidelines, putting themselves at extremely ill effects for health and extremely high risk for a number of diseases, both the mother, the child, all the family members.
I mean, talking about the vulnerable, the mother has to take care of the child, and the children are in that room, usually sometimes a very small room and not very good ventilation. So what are the challenges to change?
There's challenges to the individual level, but also to the policymakers. First of all, there needs to be a lot more investment from policymakers and the financial community to really push this agenda to clean energy access and make it a reality. A lot of investment goes into electrification, where there's but much more progress could be made if you really to put some further investment into clean cooking. Then there's this idea of actually communicating this information and what clean cooking can do for the health and the well-being of the people living in the home. So it's important to really communicate to the family what these benefits are, and also to teach them how they can change, because behavior change communication is one of the key things to really ensuring adoption of clean energy.
So before I come to you, Nathan, Heather, let me just quickly ask you, what are the fuels responsible for indoor air pollution?
Well, it's really important to consider that it's the fuel and technology combination, because it's the inefficiency of this energy use that is really the cause of the pollution. So currently, because there's not a lot of scalable stoves that WHO can consider clean for health, it's those stoves that are using biomass fuels or unprocessed coal, for example. Kerosene is another important source of health-damaging pollutants. So in terms of clean, we're really pushing right now for electricity, natural gas, liquefied petroleum gas, ethanol fuels, biogas, etc. And we really hope moving forward that we're going to see some advanced combustion stoves that really are clean for health moving forward.
Let me take an audience question from Heather first.
Great. Thanks. We actually have a couple questions. One is from Han, one of our viewers. What do you think about carbon pricing or a carbon tax? Does it really work? And is there any evidence that it works?
I think it depends on the context and the way the system is set up. I think it really depends on how the system is put in place. And in terms of the carbon tax, it's a challenge because in some cases the pollutants that are actually very damaging for health and climate are not the ones that are necessarily getting the tax. So it requires a very well thought out solution in a particular context.
Maria, let me direct that question to you as well.
Yeah, I think what is important to understand is that we need to move to a clean source and sustainable sources of energy. And this will condition our health dramatically. As Heather rightly say, we still have in the world 40% of the world population, 40%, almost half of the world population cooking and heating and lighting their house like in the Stone Age almost, where resulting in this terrible pollution going into your lungs. How do we do this energy transition, what we will call as WHO the healthy energy transition? clearly we need to start to look at how we go beyond the fossil fuels time, and what are the taxes that it's clear that the use of coal is having an incredible price on our health. And this has not been incorporated into all the debate about the cost of air pollution or the cost of the climate change. So different issues can be contemplated here, but clearly the price, as I say, is paid by our health, and this is absolutely unacceptable. So decarbonizing our society is clearly, or not investing on subsidies for coal, that's another very effective way of doing it, and clearly moving to more and sustainable and renewable sources of energy that will not be pollutant. Understanding that obviously there will be a transition, but the sooner we finish this transition, the better for our health.
Right. Let me bring you in at this point, Nathan. You have said that climate and air quality are two sides of the same coin. Unpack that for us, please.
I think that's exactly right. They are indeed two sides of the same coin, even though historically on a policy and even governmental level often we treat them as very separate issues. There are very few, very few sources of air pollutants that do not also emit greenhouse gases. And indeed, actually, there are very few air pollutants that impact human health and ecosystem health which do not also impact the climate. On the flip side of that coin, there are very few sources of greenhouse gases which do not also emit air pollutants, which harm human health and ecosystem health, or contribute to the formation of secondary air pollutants, which harm ecosystem health and human health. And so, in that vein, I guess for those who don't know about the Climate and Clean Air Coalition, we're a voluntary coalition of countries and UN agencies like the World Health Organization who focus on an integrated approach of looking at air quality and climate to help us identify concrete policy and technical measures that can provide near-term benefits in terms of air quality, health, sustainable development, and climate. Many of the measures that have been talked about here today, indoor air quality is a significant issue. It's also a significant driver of near-term climate change, and the measures that are discussed in this report will contribute substantially not only to improving human health and ecosystem health, but also actually reducing the rate of climate change. And if I could just throw out some other big numbers, we've had some big health impacts numbers, but I'd like to throw out some big climate benefits numbers and air quality benefits numbers potentially. With this integrated approach of looking at air quality and climate, we've been able to identify 16 concrete policy and technical measures which deployed both to reduce indoor air pollution, outdoor air pollution, and climate pollutants. It could cut the rate of warming in half over the next 20 years and save potentially about 2.5 million lives. People who are dying prematurely right now due to exposure of fine particulate matter air pollution outdoors, and many more millions potentially from reduced exposure to indoor air pollution.
Nathan, there are some tools that have been developed. Talk to us about that.
Yes, this is very exciting work that we're doing with the Climate and Clean Air Coalition and our partners. We are currently engaged in something we like to call the multiple benefits pathway approach. To sum this up very simply, the approach is we have these long-term climate goals, very ambitious climate goals set in the Paris Agreement, but the pathway that we take to achieve those goals, both in terms of air quality and climate, matters, is extremely important. In fact, just as important as achieving the long-term goals. And for those people currently suffering under the crushing burden of disease from air pollution, it may actually be more important, the pathway, than eventually achieving those goals. And to define the pathway and help empower our partners and broader community to really understand how to integrate air quality and climate, look at measures that provide near-term benefits, both internally for them and benefits globally to the common good of avoiding climate change, we've developed a number of tools with our partners like the World Health Organization. They have a number of tools that are being developed, UN Environment and the Stockholm Environment Institute, and we are deploying those tools with our partners to really analyze their air quality and their climate activities across a spectrum of benefits and impacts, and really define strategies that achieve both their health, their sustainable development, and their climate objectives in the near term over the next couple of decades, as well as throughout this century.
Well, thank you very much, all of you, for joining us today. Thank you. Now, you heard Maria mention just now that air pollution can cause an estimated 25% of deaths from heart disease and stroke. Now, heart disease and stroke are the leading causes of death globally and have been for more than a decade. In addition to air pollution, another big contributor to heart disease is in some of the food that we eat. One of the biggest culprits is trans fatty acids in our food. Last week, WHO released a new plan to eliminate them from our food supply. I have two people here to discuss this with me. Dr. Francesco Branca, Director of Nutrition at WHO, and Dr. Tom Frieden, President and CEO of Resolve to Save Lives. Welcome, gentlemen.
Good afternoon.
A little bit of background so that our viewers can send you some questions. Dr. Frieden was previously Director of U.S. Centers for Disease Control and Prevention, and his initiative Resolve is created to encourage countries to reduce and to ban trans fats and reduce salt content in our food. And WHO's new global plan is called Replace. I'm going to talk about that a little more. But this is about the food that you eat. So this is personal. Send us your questions for our experts. Let me start with you, Dr. Branca. What are trans fats and what do they do to our body?
Trans fats are fats that are produced during an industrial process. So basically, you start from the liquid vegetable or fish oils. Then there's a process called hydrogenation, which makes the fat harder, so that they can be used for cooking. They have a longer shelf life, so they last longer. They're used for bakery products. They're used for frying, and they've started to pick up in the 50s when we tried to get rid of the saturated. But unfortunately, also the trans fat have a negative health effect. They bring up our low-density lipoprotein cholesterol, and they eventually produce the atheromasic plaque, and then they're responsible for heart disease. We calculate that we can attribute over 500,000 deaths to the intake of trans fat. And they can be found in certain countries much more than in others. Trans fat are also naturally present in dairy products and meat, but in small amounts. So if you have a sort of an average adult diet, you can get your trans fat, which is recommended by WHO, maximum 2% of the energy in 50 grams of butter. But if you eat only a single biscuit bought in a market in Central Asia, you also easily exceed that limit.
Dr. Frieden, let me bring you in at this time. Why this initiative at this time, and is it achievable?
Artificial trans fat was added to our food before people realized that it's toxic. As Dr. Branca said, it kills more than 500,000 people around the world every year. Already, several dozen countries have eliminated artificial trans fat. Unfortunately, it's been mostly rich countries. We want to make sure that on a basis of equity and also promotion of health, we eliminate this toxic product from the food supply. The World Health Organization, with the Replace package, has called for the world to be trans fat free by 2023. The remarkable thing about eliminating artificial trans fat is that it's very doable. Denmark did it first 15 years ago, and deaths have come down as a result. Every day we don't do it, we're putting people at risk from a chemical that they don't know is being added to their food, they didn't ask for, and is increasing the risk of a heart attack and death. Replacing artificial trans fat won't change the taste, won't change the cost, won't change the availability of great food. Only your heart will know the difference.
So let me break this down for our Facebook audience. If you can elaborate on what are the foods, you mentioned some of those where they are consuming trans fatty acids. And then tell us about how will our food look different? Is this going to impact removing trans fatty acids from the food chain? Is this going to impact the prices, for instance?
No, in countries that have done the elimination, as Dr. Frieden was saying, nobody noticed about it, and there are adjustments to the price. Clearly, what needs to be done is to replace with healthy oils. We don't want to replace the trans fat with saturated fat again, because there will be no positive effect. So it's using healthy oils such as canola oil or safflower oils. There are other oils that can be used, and this will not be felt by consumers. At the moment, if you go in certain markets such as India or Bangladesh or Pakistan, you have extremely high levels of intake, and up to 6%, which is 3 times what WHO recommends. If you go in buy street foods, this fried street food, that's also containing quite a lot of trans fat, but also some of the manufactured food, bakery food that you can find in many of these markets.
What kind of challenges do you expect? The industry will be expected to make some big changes. What have we seen on the ground that makes us hopeful that this can be done?
It's encouraging that the World Health Organization has made the elimination of artificial or industrially produced trans fat one of their indicators, their core indicators for the general program of work that's being considered and we think will be adopted at this World Health Assembly. That means that all WHO central, Geneva-based regional country offices have this as a mandate to support countries to eliminate this product. And with Dr. Branca's team now, there's a great package, a technical package called Replace. 6 key elements that any country can do to get rid of artificial trans fat. We think it's quite doable. It involves understanding where it's coming from. Yes, there are some companies that produce it that will be inconvenienced. And this is why it's important to give them a couple of years to transition. There are lots of healthy alternatives, as Dr. Branca mentioned. Soy, sunflower, canola, they're all readily available. Often they're made in the country more so than the trans fat products. So it may be something that's more locally produced, but it's certainly much healthier.
I want to take a question from our audience now, Susanna.
Great, thank you. So we also have viewers joining us from Sri Lanka, Cambodia, the UK, Spain, and the Philippines. We've got a question from Lemlem in Japan, wondering if trans fats have other side effects besides increasing LDL. What other actions can be traced to the toxicity of trans fats or side effects?
Sure. Well, trans fat have also been linked to other potential conditions such as diabetes. The documented evidence we have particularly is on heart disease. Replacing trans fat is something that we will have to do with this policy package. It is about, first of all, looking at the policy environment and looking at how to establish a legislation. We believe that we only can eliminate trans fat by having some good legislation in place. And then by having a proper assessment of the food environment. We need to be aware of what we eat.
As Dr. Branca says, what artificial trans fat does is it increases the bad cholesterol, LDL. It decreases the good cholesterol, HDL, which makes it the most harmful of all of the oils. That's proven. It may also change inflammation and increase the risk of diabetes. That's not certain, but it's certainly enough grounds, given the cardiovascular problems that it causes, to say that with good reason, the days of industrially produced trans fat are numbered.
Dr. Branca, I'll give you the last word on this. We're running out of time in this segment, but could you, in 30 seconds, talk about Replace? How will that help countries remove trans fats?
Just need somehow a roadmap, and so Replace is an action package, a step-by-step roadmap to help understand the situation, create the awareness in the public opinion, establish the legislation, find the right replacement, help the food system make those changes, and then monitor the implementation and make sure that it's enforced. And we have the ambitious target to eliminate trans fat from the food system in the world by 2023. It can be done. It's been done by some countries. We want it to happen in all countries, particularly in low and middle income, that will benefit a lot from this action.
Thank you very much, gentlemen, for joining us.
Thank you.
So, because of the change in our lifestyle, we know that we are less active now, we're eating less healthy foods, and this is what is contributing to diseases. Millions of people are dying prematurely. To help change this, the UN is holding a high-level meeting on these chronic diseases, the diseases that we call non-communicable diseases, later this year at the UN General Assembly. Now, one of the topics being discussed at the World Health Assembly this year is assistive technology, devices that are needed to help people with physical limitations. 1 billion people need assistive technology today, and this figure will rise to 2 billion by 2050 as the global population ages and as chronic diseases increase. Assistive devices can be essential to help people live a healthier life and a more fully functional life. But you might be surprised to know that only 1 in 10 people who need assistive products have access to them. For example, 70 million people need a wheelchair, but only 5 to 15% have access to one. Hearing aid production meets only 1% of the global need, but 3% of the and in low-income countries, it's only 3%. So clearly, there is a big need for assistive technology, and we're not reaching enough people. I want to welcome my first guest in this segment, Dr. Sana Hafiz. Assalamu alaikum, khush aamdeed. Welcome on our show. You are the first WHO champion for assistive technology, Sana. Can you tell us how this came about? Tell me about your background.
First of all, thank you for having me here. It's really a pleasure to be at this forum. I was a final year medical student. It happened on 18th March 2016 when I attended my good friend's wedding. It was not an unusual wedding. It was a typical wedding with a lot of festivities going on amongst friends and families. We were all celebrating when suddenly a heavy metal pole from the scaffolding above, it fell on my back, resulting in the traumatic spinal cord injury. Within a fraction of a minute, I lost consciousness. After regaining consciousness, I tried to move my legs but couldn't. And being a medical student, I knew about spinal cord injury, and at that very moment, I came to know the gravity of the calamity that had struck me. After a delay of 2.5 hours, I was taken to a nearby hospital. When I was taken out of the ambulance, it was raining. I could feel the raindrops pouring on my body, but not on my legs and feet. I had lost my sensations. And in that moment, I came to know the catastrophe that had struck me. I was lying on the hospital bed with 2 fractured vertebrae. It was really hard for me. It was really frustrating, and I was really helpless. I cried, I screamed. My parents, they are still hopeful that I will walk again. But being a medical student, I knew the condition that I have to face now. So I had 2 options, like either sit on the bed all day and cry, or to start my new life, a journey of healing. So I did not give up. I did not want to give up because it was my final year of medicine. So I enrolled myself into a rehabilitation program. Before my injury, I never knew about the rehabilitation services. But it was after my injury, I searched about it and I enrolled into a program that helped me consign a wheelchair. When I was able to sit on a wheelchair, I went back to my university, I resumed my studies, and I completed my final year in first attempt. And after that, after my graduation, I completed my 1 year of house job training, which is mandatory. And then I cleared a UK exam for my specialization. And I did not want to give up. And this is how then I was nominated for the World Health Organization Global Champion. And
It's
I
a
reached
long
this
journey, Sana, from this terrible accident to being a champion for WHO. Tell me, what are the challenges, people who need assistive technology, what are the challenges on the ground for them?
There are many challenges that are faced by me and people like me, especially in the developing countries. The biggest and the most foremost challenge that was faced was the awareness about the need for assistive products. There are several assistive products, but in rural areas, people do not know about it. And even if they have a little knowledge about the assistive products, they are not able to afford it. The awareness and affordability, they are very closely related. And because of this, many people cannot live a normal, healthy life and a productive life. Also, there is a barrier of accessibility. When on my wheelchair, I went back to places, public places. It was hard for me to reach certain places because many entrance and exits, they were not accessible for everyone. But with the demography changing, it's not just for the disability. It's not only for the disabled people that need an accessible environment. Even older people need an accessible environment. It is not a luxury. It's not an add-on item. It is a must now. Another barrier that was faced by people was the sensitivity. People are not sensitized to the issue of disability, and hence not many measures have been taken. Also, there is a lack of governance and policies that would help otherwise to improve the access to assistive technology.
Awareness, access, having the right kind of assistive technology as well. I want to bring my second guest in, Dr. Danny Gaymore. Dr. Danny Gaymore is Head of Global Funds Department for DFID. Dr. Gaymore, UK government is taking the issue of assistive technology very seriously. Why is that?
Well, firstly, thank you very much for having me. It's a real pleasure to be here, and I'm very pleased to be able to sit beside Sana again, as I was able to do earlier this week on a panel discussion that we had where we were discussing some of these issues. And I suppose I want to start actually by once again paying tribute not only to Sana's own journey as you describe it, but that bravery and commitment, tenacity, that we see in Sana, but also many people who are in countries around the world where very often the services that they need, the assistive technology that they need are not available. And you really are relying on your own commitment to drive these things forward. For the UK government, we are very committed to taking action in this area. This summer in July, we'll be holding a summit on disability, where we're bringing together community groups and businesses and ministers and governments and others to really push home an issue that has had too little attention in international development, but actually in many countries around the world. And one of the key things that we really want to see progress on at that summit and in our work is around assistive technologies. We've seen enormous success in the last 10, 15 years on using new ways of looking at products and commodities and medicines that people need in relation to HIV, for immunization, for family planning, and for other areas where we've been able to reduce prices, improve quality, have the right sort of formulations that work in the right way for people in different settings in different countries. And it feels that there's an enormous opportunity here to take the resolution that is going through the WHO now, to look at the long list of technologies, assistive technologies that the World Health Organization has drawn up, and apply similar ways of shaping the market to make key products like wheelchairs or glasses and hearing aids and digital apps and other products that people need so much also more affordable, more available, more accessible in the countries that we need the most, and we hope we'll see good progress in July.
Thank you very much, both of you, for joining us. This is a very important topic. It's clearly being prioritized here at the Assembly, and we hope to have you back at some point and talk more about this issue. Thank you for joining us.
Thank you very much.
Thank you very much.
Since this is also WHO's 70th anniversary, we're closing every show this week by talking about and reflecting on the achievements of the last 70 years. Now, the Millennium Development Goals were set in 2000, and in 2015, countries came together again and pledged to the Sustainable Development Goals. These two goals together ensured that countries, public health actors and agencies all are aiming in the same direction. And in this segment, I want to talk about two areas of work outlined by the global goals. First is to reduce death in children under 5, and second, to improve maternal health. Joining me now, Dr. Ornella Lincetto. Welcome. Dr. Ornella, you work on women, children's health in WHO. Let me start by talking about improvement in maternal health. Although there's been a lot of progress, but in 2018, why do we still have women dying during childbirth?
Thank you. So maternal mortality has declined and is declining actually because more and more women in the world have access to preventive and curative services before, during and after pregnancies. But yet there are some causes, preventable causes, that are still killing women, such unsafe abortion, hemorrhage, maternal sepsis, eclampsia. These are all preventable causes that were killing women in the past and are killing women today. But actually, women are dying where the services to address these conditions are not available, or also when the services are of poor quality. So it's also lack of access means also lack of awareness sometimes on the side of the women on what are the services available or even their own rights. So there are a number of issues, underlying factors that in addition to health systems factors cause the maternal mortality today.
So we're going to talk in this segment about reducing maternal mortality and deaths of children under the age of 5. Please send us your questions. You can tweet us your questions at WHO using hashtag WHA71 and hashtag SocialGood. Let me continue with you, Ornella. What do we need to do to keep the number of for maternal mortality down?
Well, there are a number of issues. First of all, it is to expand universal coverage of maternity services. Certainly that is the mantra, I think, for us. But in addition, this means, in particular, this means to look more at the quality issues. Quality, universal coverage without quality is not sufficient. And we heard this also in the session at lunchtime. We need to look more at the equity, because we need to reach the women that are not accessing services at the moment. And we need to work more on accountability. Accountability in the sense of better collection and analysis of data, but also social accountability, more participation of women and people in the decision regarding care of themselves and their families.
Let me take an audience question at this point. Susanna?
Great. We've got a question asking, how does the World Health Organization work with other UN agencies such as Unicef to help children stay healthy and reach their full potential?
On the issue of maternal?
On the issue of maternal health, right?
Mm-hmm. Yes, exactly.
Well, there are many ways where we work. We have, of course, we work under the global strategy for women, children, adolescent health. We have partnerships like the Partnership for Maternal, Neonatal, and Child Adolescent Health. We have the Every Newborn Action Plan, which has also a bit of a component of maternal health. And we have this at global level, but we have also a lot of work, many initiatives at country levels. Through the the country teams and One UN approaches. We have some specific initiatives that are, for example, on the quality of maternal neonatal services that we have launched the last year, and is focusing on very much on maternal neonatal improvement, strengthening the quality improvement mechanism in countries in order to address better survival of women newborns, and in the future will be also for the children.
I want to bring into our conversation at this point Dr. Francisco Duque, the Secretary for Department of Health in the Philippines. Welcome to our show, Dr. Duque.
Thank you very much in behalf of the Philippine Department of Health. It's actually Dr. Duque. Yes.
Thank you for correcting me. My apologies. Dr. Duque, you have a very unique program in the Philippines, which was very well designed and saved lives of newborns. Describe that program to us, please.
It's not limited to saving lives of newborns, but it is also to address the relatively high maternal mortality rate in the Philippines. And I'd like to showcase the project collaboration between the DOH and the WHO. This is in particular Davao region in the Philippines, where let me just start off by giving you a brief backgrounder of the data. That's so compelling. That's why this project was thought of and implemented successfully. The maternal mortality rate in the Philippines continues to be high. This is at 162 per 100,000 live births, and this was in 1990. And a very modest, if not very little, reduction has been achieved. This was brought down to 114 maternal deaths per 100,000 live births. And we missed our Millennium Development Goal in 2015, which is 52 per 100,000 live births. And at about the same time, our newborn mortality rate was 20 in 1990, and this went down to 13 per 100,000 live birth. And we've missed by just one the MDG goal of 12 newborn mortality per 1,000 live births, rather.
I want to come to audience questions in a minute, but
Sure.
describe to me why this was so successful, this program.
The project highlights the fact that if the interventions or the approach is strategic and systemic, and this approach has three important elements. Number one is the engagement, enhancement of governance by engaging the local government units within and beyond the health sector. Number two is, of course, the maintenance of the functionality of our health facilities by provision of appropriate and adequate human resource for health, and also the provision of very important equipment and supplies. So these are the three elements that more or less would point to a very successful project between the DOH and the WHO.
Real success story from the Philippines. Let's stop for a minute, take an audience question. Susanna?
Our viewers would love to hear about what they can do at home to help advocate for healthier mothers and healthier children.
Sorry, can you repeat the question, please?
Sure. Our viewers at home would love to know more about what they can do to help advocate for healthier mothers and healthier children.
For you, Ornella, and then I'll come to Dr. Duque. How viewers can advocate for healthier mothers and healthier newborn and children. Yes. How our viewers can advocate for it. How can they be involved?
But they are, first of all, through participating. I think participating in disseminating the messages on the importance of universal coverage, on the importance of prevention versus care, on the value of women, in the society, on the value of neonatal survival. Sometimes newborn is considered just, even not a person in some societies. So the importance of newborn, and the importance also of of the special time that the pregnancy and childbirth and newborn is in society, and giving the value that they deserve, supporting the women during that time, because it's very special. And so I think this could be, the message, but also the support and the participating also in decision regarding the services, regarding not, I think participation is very important.
Thank you, Ornella. I'm going to give you the last word, Dr. Duque.
Well, to me, it's education, education, education. It's very important that before people participate, they have to have a clear understanding of what are the relevant public health programs that will ensure the health of our people, especially the mothers and the children. And so that to me is a sine qua non, very important conditionality. before even making them participate, so that the participation can be more meaningful. They've got to have a modicum or a basic knowledge and understanding of the existing public health programs, which cover the whole spectrum from health promotion to disease prevention to curative phase, rehabilitation, and the palliative phase of the whole spectrum of care.
Thank you very much, both of you, for joining us today.
It's our pleasure. Thank you.
Thank you. So another group whose voice often gets lost in the discussion is the health of young people or adolescents. Young people between the ages of 10 and 19 make up 1.2 billion people. That is, 1 in every 6 persons on earth is an adolescent. It's a voice that is often not heard, but one person who's trying to change this is Angela Nguku, who leads this work in Kenya for the White Ribbon Alliance. Angela, thank you very much for joining us. Start by giving us an overview. What are some of the biggest issues facing our adolescents, and why is that their voice lost?
I think we all know that adolescents, like the time of adolescence, that is between the age of 13 through to 19 years, it's a very vital stage. And in a stage that if nothing is addressed or their issues are not addressed, we lose a big chunk and then it affects us later in life. But what we are seeing is that a lot of programs that are designed for around health only target either the 0 to 5, then 5 to 10, then it crosses over to when women now start giving birth, realistically from 24 years. But a lot of times, that vital stage is not really tapped. And what we see a lot are fragmented programs that talk about addressing adolescents and young women and girls. But we know that the issue is not really being addressed. If we look at the impact, for example, in the country that I know best, that is Kenya, we realize that, for example, one of the problems that we are facing now in my country is that we have so many young people, very high rates of teenage pregnancy. For example, 24% of the Kenyan population now is aged between 10 to 19 years. We have 13,000 girls dropping out of school every year because of pregnancy-related complications. We have 1 in every 5 girls in Kenya being either pregnant or a mother already. And these are issues that are affecting women, such that young girls and adolescents, such that they never live to transform, live to survive, live to thrive, to really transform the societies. So it's an issue that is really not being addressed, but it's being pushed within other existing programs. Yeah.
So you work on a regular basis with adolescents at the country level. What do you expect when you're at these meetings? What are the goals that you come here with at an assembly like this?
One of the key things is that I always wish to see and wish to bring is the voice of that adolescent, the voice of that young person. And it's interesting such that I've attended several forums, the World Health Assembly being one of them. And in every forum that I've gone to from Monday, we are talking about adolescents and youth. But looking around, do you see them? Do you see adolescents? Do you see young people? So where is that voice? Because a lot of times we assume that we know what these people need. And working with them and remembering what I went through when I was growing up as an adolescent or a young person, I really feel the voice of these people is not on the table. Even in these forums, I feel they're the same things that we're talking about. But that voice of that young woman, that girl, is not really on the table. So working with them, I've come to realize that all this, what they need is that voice for them to be on the table, not as flower girls, as they always tell me that, Angela, we are tired of being used as flower girls, but we want to be used, we want to come and actually engage. And for us to be able to do that, we have to give them the skill and that capacity for them to be able to do that. Yeah.
Angela, last question for you. Talk to me about some of the results you're seeing on the ground of your work.
What I'm seeing is that when you empower these people, for them to realize that they have the rights and entitlements to actually be able to engage with the duty bearers. And duty bearers is not just the politicians. It's like you and me. It's like the service provider when they go to the health facility. They are able to actually voice their issues and bring it to the table. So what I'm seeing is that the more we we train them on their rights and entitlements, as per the Kenyan Constitution, for example, when we give them the skill, when we help them realize that they have the same rights that anyone else attending that health facility, we see them engaging. I'll give you an example. We've trained them on being citizens with a voice. We have trained them on how to actually hold their duty bearers to account. We've trained them on how to be able to be impactful wherever they are working. And they have gone ahead and asked for a space in the health management teams, for example, in the health facilities. What are we seeing? We are seeing them now being included in the health management committees. We are seeing them being given a room in one of the health facilities to be able to actually receive their SRHR commodities, to be able to be cancelled and all that. So we are seeing a lot of, and they are, it's creating a ripple effect, because we are seeing them going beyond to other people in schools, out of schools, and we are seeing change in the health facilities, change with their policymakers and the like. And that is what really made us now talk about, come up with a campaign on what women want. Demand for quality reproductive health for women and girls. We never left out the girls because we know the girl has been left out for so many times. And this campaign is setting out to ask 1 million women and girls their number one request for quality reproductive health, care, and rights. And we are hearing many, many things. Others are talking about inclusion, respect, financing, all these things that I have not yet heard them being discussed in this forum.
Angela, thank you very much for bringing your powerful voice to this assembly and the voices of adolescent, young girls and boys. Thank you for representing them at this assembly.
Thank you.
So you just heard the importance of hearing young voices at global forums like this. We understand, we want to make sure that young people are represented in WHO, that women's voices are heard in WHO. WHO is taking this idea one step further. Joining me now is Ms. Dia Saminarsi. Welcome, Dia. You are the advisor on gender and youth, and this is a new position in WHO. Talk to me about this position.
It's the first in WHO history. And the task is to mainstream gender and youth, meaningful engagement within the organization as institutional reform, and also to bring the issue forward and make sure that the implementation is done by the masses.
So we just had a very powerful speaker talking about the fact that we don't have enough young people represented at global forum where decisions about their health are being made. But at the opening of the World Health Assembly, for instance, our Director General talked about our interns and opening up and making it easier for interns to join us. Why is it important for an organization like WHO to reach out to younger populations?
One is that we have the SDGs target to be achieved by 2030. And if we do not, starting today, involve the young people meaningfully, then we will never reach the SDG targets. And plus, we need to make sure that there is relevance in our work ahead. And in order to get it, we have to pick their brains. We have to work together with them and start charting our new way forward. How are we going to address the complexities of global health with some new insights from the young people?
What's happening at the Assembly on this issue?
There will be a negotiation on the intern resolution for one. There will be a youth town hall, the first ever youth town hall tonight, which I will host at the WHO HQ. And I believe it's been ongoing conversations, and we are looking forward to listen to them, to hear their inputs, and to see what they think is best in engaging them on how to move forward and bring action and mobilize movement.
Dia, talk to me about your role as a gender advisor. The Director General said at the opening of the World Health Assembly that WHO will have zero tolerance for sexual abuse. What can young people and people joining WHO expect as a workplace in WHO? On our Facebook feed, we often receive queries about, we want to work with you, we want to join you. What is WHO's workplace like when we have zero tolerance for sexual abuse?
I think the DG has made it very clear that, and give his assurance that WHO is a safe space. It is extremely important for young people or early career professionals who start their work that they are entering into a safe space, no matter where they are, at the HQ, at the regional office, country office, in the front lines, they are safe, that they are, they can expand their career and they can do it in a safe space.
Thank you very much, Dia, for joining us
Thank
today.
you, Angela.
There you have it. Exciting new initiatives underway at WHO, recognizing the importance of younger voices, younger people, for strong leadership and to create a safe space for our workforce. We have one more show tomorrow, and tomorrow's show will focus on emergencies. At this moment, WHO, in the past year, WHO responded to 50 emergencies in 47 countries. And there are several major emergencies underway at this moment. We will have our top expert here on our set to talk about it. So don't forget to join us tomorrow. Thank you very much. Bye-bye.